Lumbar stenosis is a condition where you have narrowing and pressure on nerves, and that can then cause irritation to the nerves, which will then cause pain, typically down the legs. What patients experience most commonly is difficulty walking. If they walk, they get pain in their legs. They might get some numbness, some tingling on pins and needles. Sometimes they have to stop and rest, and then symptoms get better and they can carry on walking again. So lumbar stenosis is largely caused by degeneration within the spine, and degeneration essentially means aging changes. It's common in a lot of patients and a lot of people. Typically affects patients over the age of 55 or 60, so typically affects patients over the age of 55 or 60, but can be significantly intrusive, that their quality of life is impaired. So lumbar spine stenosis can be significantly problematic, that it interferes with quality of life secondary from pain mainly, and limitation in mobility and walking. In the worst case scenarios, if it's left unchecked, sometimes you can develop numbness, which could be permanent in the legs. You could develop weakness, which could also be permanent in the legs, and that could lead to disability. And there's also a rare possibility that you could develop bladder or bowel problems with less control. So lumbar spine stenosis is diagnosed through a detailed discussion with the patient, taking a history, examining patients, and essentially some form of imaging of the spine will be required. And most commonly, that's going to be an MRI scan of the lumbar spine or the lower back. Sometimes for patients who can't have an MRI scan due to other medical reasons, like for example, if they have an implant that's not compatible with an MRI scan, there are some other tests that we can do, specialized tests that we can do. And also for patients who are very claustrophobic, there are also MRI scanners which allow for those patients to be scanned as well. So lumbar spine stenosis can be treated without surgery or with surgery. And we'll have a discussion with the patient about how bad their symptoms are, how intrusive they are. And we will discuss conservative treatment, which can be physiotherapy, trying painkillers, different types of analgesia to try and anti-inflammatories to try and improve on pain. There's also special medications you can try for nerve pain. You could also try injections potentially to try and see if that helps settle pain and improve function. And also there's surgery where we can physically create space around the nerves, remove that stenosis, and that works well for patients in terms of leg pain and ability to walk.